So good evening. Today's discussion would be mainly about the COVID vaccine, which is in everybody's mind today, about certain myths and facts that is running around in the public, in the social media, in WhatsApp and everything. Before that, I would like to wish everyone a happy World Health Day, that is on April 7th. This year's theme is about creating a fairer and healthier tomorrow, is the theme of World Health Day today. How to create a healthier world is about getting educated about health is most important than getting treated per se. It simply means you should know when to consult a qualified doctor and how to prevent a disease. Before consulting a doctor for a treatment, you should know how to prevent a disease. Prevention is the first step to keep yourself healthy. So know about a disease, prevent the disease. If at all you cannot prevent a disease by some unexplained or unavoidable circumstances, please consult the concerned doctor as early as possible, get diagnosed, get treated, and keep a regular follow-up with the doctor. All these steps together will give you a healthier tomorrow. Okay, today let us come to today's hot topic, that is COVID vaccination. I will be basically describing about the vaccine and telling you certain myths that are in the public's mind. And I would be trying to resolve what is right, what is wrong, based on whatever evidences we have. So primarily, these COVID vaccines which are in India right now are the two. As everybody know, it is Covishield and Covaxin. I think you all know this. So again, people have it in mind that should we take Covishield, should we take Covaxin, should we really get vaccinated? I have already got COVID, should I get vaccinated? I am on certain medicines, can I get vaccinated? I have a small child, can he be vaccinated? There are so many questions around. So I will be discussing the common questions that are found in public's mind. After that, any other questions you have, I will answer all those questions.
Usha Sridhar, please mute ಮಾಡ್ಕೊಳ್ಳಿ ಮಾ.
Yeah, the most common question that we find in the public mind is should we take the vaccine? What are the side effects? Many people say, please do not take, you will have this side effect, that side effect. Some of my relatives have taken it, they have developed something. So I'll just briefly discuss about two different types of vaccines. One is Covishield. See, Covishield is a vaccine that is given intramuscularly to your deltoid, where you will develop some amount of injection site pain, some amount of body ache, fever, headache, which are very common post-vaccination effects which are found. Other than that, there are no serious adverse effects that have been documented till date. At some places, they have found out certain complications, but which were not actually related to this vaccine. And Covaxin is another type of vaccine which is available. Even this vaccine has the same common side effects as fever, body ache, headache, tiredness, everything. With that, there are two more extra side effects with Covaxin. That is, the patient might develop some amount of abdominal pain, nausea and vomiting sometimes. This is an added side effect of Covaxin. Otherwise, there is no significant side effect that has been detected. Rarely, very rarely, they have correlated certain demyelinating illness. That is, some rare events of demyelination has been found with Covaxin vaccine, but they have not yet proved that it is due to vaccine only till date. This is one. And second thing, the myths that is running around is If we, some people have got COVID positive after taking the vaccine. That is about a week or 10 days after taking the vaccine. So they have a doubt. I have taken a vaccine, still I am tested positive. Do you feel it is due to vaccine only? I will tell you, the vaccine has been given intramuscularly. The antibodies to the vaccine will start developing inside the body in the blood. So there is no way that the virus can spread by injecting a vaccine, because the vaccine which is being given, that is Covishield, is a viral vector vaccine. It simply means a part of the virus has been injected into a different kind of adenovirus which infects the chimpanzees. That is injected into our body, which doesn't cause any COVID-like infection to us, nor that creates any spread to other person. And even Covaxin doesn't have any such role that it can cause an infection after taking a vaccine. But we have been finding many cases of COVID positivity after vaccination. That is mainly because of overcrowding at the site of vaccination. When the public comes to take a vaccine, they sit in a crowded place, or when they wait for 30 minutes post vaccination, many times they remove the mask, they start speaking to each other, and that is the time they get contacted with the virus. So it is not the vaccine which is causing the infection, it is taking out the mask, chatting with your friends during the at the vaccination site, which is causing this post COVID vaccination COVID pneumonia. So you need to be more cautious when you take a vaccine. That is, don't sit in a crowded area. Please turn away from each other. Don't face each other. Don't keep talking or chatting in that waiting area. That is what I recommend to prevent post vaccination COVID. Second thing, please do not stop wearing a mask. Some people feel that after taking a vaccine, immunity develops. So should I really wear a mask? Yes, because both the vaccines that are given in India are not 100% efficacy. Doesn't show 100% efficacy. They are about 70 to 80% efficacy has been found. So the remaining 20 to 30% people can still get infected after the vaccination. One more thing is, after taking the vaccine, that is, you take a first dose, you take a second dose after about 28 days. After taking the second dose, the body immunity starts developing completely by about 2 to 3 weeks after the second dose of the vaccine. So some people feel, sir, I've taken the vaccine today, can I travel tomorrow? I say, yeah, you've taken the vaccine today, but your immunity to the vaccination, whatever has been taken, has not developed by tomorrow. After taking the second dose, you need to wait for at least 3 weeks for the immune response to come. In spite of that, even after 3 weeks of the second dose, still you may get infected with COVID. You might become infected, still you might have COVID pneumonia. Then you might ask me, what is the point of taking a vaccine? Correct. See, as I said, it is 70 to 80% efficacy has been found. So the remaining 30% in whose body the immune response is not adequate, they might get infected and they might turn serious also. What is the point of vaccinating is, when you take a vaccine, the seriousness of the infection will come down. It doesn't mean you will not get COVID, but the seriousness of the infection will come down. That is why we are vaccinating. So it is always recommended to take a vaccine, not to completely prevent the disease at present. It is to decrease the seriousness of the disease. So we encourage everybody to take the vaccine. Some people say, no, I don't want, I'm already infected. I'm already been infected. Antibodies are already being produced. I will not take the vaccine. It is not like that. Even after the person has been infected with COVID, many times the immune response to the infection might not be that good. So we still recommend them to take a vaccine so that your immune response is much, much better, so that the second episode of COVID infection might be avoided. Yeah. Again, there is one more doubt. once I get COVID, will I get COVID again? Till date, there is no data to say yes or no to this. Person who had already COVID infection might get COVID, might not get COVID, which has no literature to say that whether the patient can get or cannot get. That is the reason, even after COVID infection, even after discharging the patient, we still tell the patient that you have to continue wearing the mask for two reasons. One, you should not infect others, nor you should get infected again. So we still do not know if the COVID infection can occur repeatedly. I think that needs little more time. One more doubt which many people have is, I am taking a blood thinner tablet. Can I take the vaccine? Because everywhere there in WhatsApp and some doctors, many people say that you are not supposed to, you please consult your doctor, you're taking a blood thinner. Correct. There is a guideline where there are different kinds of blood thinners actually. See, commonly patients with heart disease, to all these people, we prescribe antiplatelets, that is aspirin and clopidogrel. Commonly, you get it as ecosprin and clopidogrel, which is prescribed to patients who have undergone angioplasty, who have had a heart attack, who have had a stroke, or who have had a bypass surgery. These patients are taking aspirin and clopidogrel sometimes. Such patients need not get away from vaccination. They can still take the vaccine in spite of taking these medicines. They need not stop this tablet at any point. Initially, some people were saying, you have to stop this tablet for 5 days, 6 days before taking the vaccine. There is no such proof. There is no such recommendation that has been given. And this I'm speaking to you with not my knowledge. The government itself has given a clear-cut data saying there is no such contraindication to the vaccine for people who are taking aspirin and clopidogrel. Then what are these other blood thinners to which you should be cautious is, for some people who have had a blood clot in their legs or blood clot in their lungs, in such patients, we give something called anticoagulants. Anticoagulants in common use are warfarin, acetrom, dabigatran. There are many other medications which are called anticoagulants. These anticoagulants, patients who are taking anticoagulants have a high tendency to have a blood clot after taking the vaccine. That is, when we inject the vaccine intramuscularly, they may have a blood clot at that site. So you need to consult a doctor before taking the vaccine if you are on anticoagulants, not these regular blood thinners like aspirin and clopidogrel. Okay. And other myths that have been running around is, some people say that vaccines can cause infertility. Even we didn't know actually. There is no such research that has been made that says taking a vaccine causes infertility. Okay, that is totally a myth. Please forget it. Okay. And second, other things which have been running around is how is it possible that they have found a vaccine so fast? For many other diseases, they take years together to find a vaccine, but for this, they found it very fast. Is that really possible? Yeah. See, what happened was, the government took an initiative, the world took an initiative to speed up the whole process. You might ask why this cannot be done to other vaccines also. Yeah, I'll come to that. What the government has done is, they did a research little faster. All the permissions that has to be given, all the trials that has to be made was done fast track. And sometimes what happens, after certain level of trials, like after they make a phase 1, phase 2 trial, that is, first they do it in laboratory animals, then they do it in a short group of people, that is phase 1 trial. In phase 2, they do a little more larger group, that is around hundreds of people will be taken into trial. What do they check actually in those trials is, first thing, are there any adverse effects, side effects? Is it fatal? Will it kill the person? Next, Next, they check for its immune response, safety. After doing all those things, it will come into the market. But all these stages were done little faster. And this phase 3 means you bring in large number of people or large number of public into the trial. You might ask us, you are doing a trial on the public, is it right? That is the reason what they do. First, they do it on animals. Once the animal trial is successful, they take a volunteer on their request that even after the most safety has been ensured, they take 10 people or 50 people and make a trial on them regarding the vaccine safety. Once it is safe for 50 people, then they take 100, then they take 500, then they take 1000. Then they come to the phase 3 trial where they involve thousands of people. Okay. Once thousands of people are given the vaccine and without any serious adverse effects, it has been successful, then they give it to the public. Okay. Yeah. And yeah, for some has a doubt that this vaccine contains various proteins like egg protein or something like that. I might have a reaction because I have egg allergy. I don't know how this came into this WhatsApp, but this vaccine, what has been prepared, has no egg in it. So there is no egg protein, there is no egg allergy. You can just forget it. Okay. Yeah. And one more thing, I have already had a COVID disease. Only should I take a vaccine? That I spoke early. And when should I take a vaccine? Usually after a COVID infection or COVID pneumonia, we advise the patient to take the vaccine after about 6 to 8 weeks. Give a gap of about 6 weeks so that the natural immune response comes to the COVID infection. Then take a vaccine so that it acts like a booster effect. There is much better immune response when a vaccine is taken after a COVID infection. That is 6 to 8 weeks after a COVID infection. Okay. Okay. ಇದು ವಾಯ್ಸ್ ಹಾಕಿ ಯಾಕಂದ್ರೆ ಡೌಟ್ಸ್ ಇದ್ರೆ ಅಲ್ಲ ಡೌಟ್ಸ್ ಟೈಪ್ ಮಾಡಿದ್ರೆ ಹಿಂಗೆ ಬರುತ್ತೆ.
Yeah, doctor, now I have put up on the chat list that Deblexa tablet has been given to my mother.
Okay.
And she had her first shot a month back and she's due for the second shot now. Should I still consult for the cardiologist that should he go in for the second shot or not?
Sir, if she does not have any bleeding per se right now,
Nothing.
And you've already consulted your doctor and he says the dose is safe right now, which might not cause any blood clots, you can definitely go ahead, sir. No issue.
Okay.
No
My
issue.
second question is, we have taken Covishield, but can we take Covaxin for the second shot?
No, sir, that cannot happen because once you take one type of vaccine, only that type can be repeated and that will be repeated. That is what the government is also ensuring it, sir.
And what about the factor of now recently they are saying they are giving the second shot after 6 to 8 weeks. Is
Yes,
that
sir.
true?
Sir, yes, I will tell you. Actually, what happened, the WHO recommended the vaccine to be taken after the first dose. It has to be taken after 6 to 8 weeks for Covishield, and Covaxin they should take it after 28 days. Okay, but what the government did was to ensure early vaccination to the public. They discussed with the WHO and came to a conclusion that we can give a vaccine with a gap of at least 4 weeks for both the vaccines. That is why after taking Covishield or Covaxin, we give the next dose after 28 days. But you can still take it after 6 weeks also. There is no problem by taking it 4 weeks or taking it 6 weeks or taking it at 8 weeks. You have time from, yeah.
But there is a rumor saying that there is a shortage and shortfall of Covishield. So that's the reason they have pushed it up to 6 to 8 weeks and above.
That I cannot answer, sir. That's very difficult. Means about the stock, about the supply, that is all related to the government. We really do not have to comment about it, and no idea about that, sir. But they say 28 days to 8 weeks, means 4 weeks to 8 weeks. Anytime you can take, and it has a very good efficacy. Yeah, and I am getting many other questions, sir. Yeah, questions. ಅಲ್ಲ ಎಲ್ಲ ನೋಡ್ಬೇಕಲ್ಲ just a second ಎಲ್ಲ ನೋಡೋದಕ್ಕೆ just a second, sir. I'll be answering the questions which I'm getting. Ilinda. Yes, there is one question from Dr. Jyoti saying vaccination itself is causing COVID infection. I had a patient with a lot of symptoms like fever, cough, etc. On HRCT, CT score was 7, which was okay. Yeah. So as I discussed earlier, the COVID vaccination per se is not causing COVID infection. It is the crowding that occurs at the COVID vaccination site, or it is about the patient not wearing a mask, putting the mask below the nose, which is causing a COVID pneumonia rather than the vaccination per se. Because in the initial phase, when the almost 3 crore population, that is the doctor population or the police, were vaccinated, we did not find any doctor getting COVID infection just after taking a vaccine. But when the public started getting the vaccine, we are finding so many cases. So it's more because of the overcrowding, not because of the vaccine. So vaccine is still be encouraged. Yeah, if one has undergone angioplasty, that is on 26th March, post heart attack recently, when can one take a vaccine? They can take the vaccine anytime, no issues at all. But only thing is, whenever patient is admitted in the hospital for any other critical illness, we generally avoid vaccinating such patients, because post-vaccination, they might develop some amount of fever, body aches, tiredness, everything. So any patient with critical illness, we avoid vaccinating till the patient recovers completely. Otherwise, there is no restriction.
What if somebody is taking some antibiotics, and are they okay to take the jab?
No issue at all, sir. Antibiotic has no link to the vaccine, because vaccine's mechanism of action is entirely different, and vaccine has no bacteria in it, nor the antibiotic has any interference with the vaccine.
Hello.
Yeah.
What about painkillers, sir?
Yeah, sir. Regarding COVID and regarding post-vaccination pain or post-vaccination fever, we always recommend to take paracetamol alone. No painkiller will be recommended, sir. No painkillers, including during admission, patient gets fever, body ache, whatever. We prefer giving paracetamol only, and we don't prescribe any painkillers.
No, for people who are already on painkillers for like Hyphenac,
Yeah.
for a couple 5 days.
Yeah.
So are they okay to take the jab?
Yeah, definitely. They can take a vaccine, sir. Vaccine has no relation to painkillers. They can take.
Doctor, may I ask my question?
Yeah, definitely.
Okay, thank you. This is Amrut here. I was treated under your care for 5 days.
Yeah, tell me, sir. Tell me.
Yeah, doctor, now after the 5 days of treatment in the hospital,
yes,
my parents and I have been quarantined at home in the rooms.
Yeah.
So we have old, grandparents at home. So we don't want to pass the infection to them. how
Yeah.
long should we be careful not to stay close to them or anything like that, sir?
Sir, generally post-COVID infection or post-discharge from the hospital, generally we advise isolation for about 10 to 14 days. That is because it depends on your complaint. Means you had a complaint for about 5 days prior to the hospital admission. You stayed in
Correct.
the hospital for 5 to 6 days. Then
Correct.
after discharge, you stay isolated for 10 days. So the usual duration is about 21 days, correct?
Correct.
So once the 21 days passes out, then the chances of infection from you to others is very, very less. So that is the reason we say you can come out of it after about 10 to 14 days after discharge. So I think after 10th day, you can definitely be free, but continue wearing a mask because neither you should infect nor you should get infected.
Yeah, thank you, doctor. And one other question.
Yeah.
My wife is currently at her parents' house.
Okay.
I have finished my 10 days of quarantine. Tomorrow I'll complete 10 days of quarantine after discharge.
Yeah.
Can she come back and stay with me, or
Yeah. Yeah, definitely. No problem at all.
any other precautions that we need to take?
I don't think so.
Okay,
Doctor,
thank
one
you.
question can I ask?
Yeah, surely.
I had taken a vaccination about 1 month back, 2nd of March. Now I got COVID positive. The reason, doctor?
Yeah. You finished your first dose, correct?
Yeah, first dose I finished.
Okay, correct. See, after taking the first dose, you got COVID infection now. That is after a
Yeah,
month, correct?
correct.
So in this month, you need to make sure that whether you are wearing a mask or did you attend any social gathering or any temple or any public transport, means where you are at high risk of getting exposed to COVID. So the infection occurs only due to aerosol transport, that is through your nose and mouth. That is only when you inhale, only then you get infected. So it is not due to the vaccine, it is because of
Okay.
inhalation, right?
Mm.
So in this month, in the last 1 week, if you have been in some place where some other person who is infected might
Okay.
have transferred the infection to you, it has no relation to the vaccine at all.
Okay. So am I better protected because of the vaccination?
No, sir, that is what I'm telling, because the complete protection that can be means complete protection means the whatever the vaccine provides, no, that maximum protection is achieved after about 2 to 3 weeks of completing the second dose.
Okay, got it.
Okay. Yeah. Yeah, I'll be answering other questions. Yeah.
Doctor,
Yeah, tell me, sir. Tell me, sir. Tell me.
sir, after the see, I have taken my first dose around 15 days before,
Okay.
and now I am infected and I am under isolation from the past 12 days.
Okay.
Past 12 days, I'm in home isolation.
Okay.
And when am I supposed to take my second dose of the injection?
Yeah, correct. See, first dose you have already taken. After 15 days, you have been infected.
Yeah.
Correct. Okay. Now we are isolated for 10 days.
12 days.
12 days. Okay. You are already isolated. You have any symptoms right now?
Nothing, absolutely nothing. I don't have cough, cold,
Okay.
nothing. Absolutely. I've almost from the past 6 days,
Okay.
I'm simply isolated in a room. I can't even, I am not able to move around also. I mean to say, I'm just isolating myself. I'm not even coming out of my room also.
Okay. 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 So what I feel, looking at your scenario, it is good to take the vaccine after another 2 weeks.
Another 2 weeks.
Yeah. So by six weeks probably.
Okay.
Means
And now there is a small shortage because I have taken Covishield.
okay.
Now there is a small shortage of Covishield in my place. I stay in Mysore.
Okay.
But people, whomever, wherever they were giving Covishield now, they have shifted to Covaxin.
Okay.
So do I need to wait for, go and ask them to get that Covishield and then only get it?
Yeah.
Because
See,
since they are, the Covaxin stuff is all gone, Covishield is gone, they are waiting for the Covishield.
yeah.
So do I
See,
need to go and tell them?
No, see, once, did you get a message for your second dose of the vaccine?
No, no, not yet, not yet.
Yeah, see, the government has ensured that you will get the same vaccine. That means they will send you a message of to get vaccinated with Covishield only for the second dose. Okay.
Okay,
So even if you go there, they will not give you Covaxin.
okay, okay.
Okay.
Sir,
Because
But you would
sir,
suggest
in how
me
many
to-
days advance do they send this message, sir?
what, sir?
In how many days in advance do they send this message that
Yeah.
Covishield has come, you can come and get your jab?
Sir, actually, I got the message one day prior.
Doctor,
Yeah.
one clarification.
Yes,
You
sir.
mentioned if you are infected, you said 6 to 8 weeks later, we have to take the vaccination.
Yeah, about 6 weeks, sir.
Just now, a gentleman of Mysore said he took a jab, first dose
Okay.
of vaccine.
Oh.
Then 15 days later, he was infected.
Correct.
And for him, you said another 2 weeks later, he can take.
Correct. That is
That
because
is after infection, 2 weeks only.
no, that is because he is asymptomatic. He is asymptomatic. Means
Okay.
he is
Huh.
only in home isolation without
Right.
any serious illness.
Okay, right.
Because he has no symptoms, we
Okay.
take such patients as safe and we allow them to get vaccinated.
There is no need for any test to make sure, doctor?
About what, sir? About the negativity?
No, since he has been infected,
Correct.
and whether there are antibodies or anything like that, whether he needs to check before taking?
No, sir. See, even if the antibodies are produced, that is what I'm telling. Even after a COVID pneumonia, you go back, you check your antibodies after 6 weeks, your antibodies will definitely be there. But when we give you the vaccine, that antibody, whatever is there in your body, they say the vaccination that is taken after a COVID infection has a booster effect. Okay. So you will be
Right.
probably you'll be much immune to it.
Okay.
That
Thank
is-
you, doctor. And a
Okay.
wonderful presentation. Thank you.
Thank you.
Hi,
Thank you.
doctor.
Yeah, tell me, madam. Tell me.
Doctor, I just wanted to know now that the second wave has started and they're saying that it's a different kind of a mutation
Hello.
of the which is going on. So just wanted to know, will the same vaccine hold good for whatever kind of mutations that's going to cause?
This is actually a very good question. Even I had the same doubt. Can you hear me?
Yes, doctor. Yes,
Yeah.
doctor.
Even I had the same doubt actually, but when we go through the government's guidelines about this question, there are something called FAQs, means frequently asked questions from the doctors to the government. They have answered this saying all the vaccination that has been done, that is about any virus, not only just COVID virus, they say even when the strains are mutated, some amount of protection will be provided the base vaccine, but they cannot ensure a complete protection. That is what they say. It is still in a dilemma.
Okay.
This is how they've answered. Actually, if you can open the website of Ministry of Health and Family Welfare or a COVID website, and if you see for FAQs, frequently asked questions, you have an answer to this. This is how they've answered.
Okay.
Okay.
Okay. Thank you, doctor. Thank you so much.
Thank you so much. Yeah.
Doctor, can I have your name, please?
I am Dr. Vinay Hosadurga. I'm a physician at Vasavi, sir. I'm Dr. Vinay.
Thank you so much, sir. You are crystal clear, sir. Thank you.
Thank you. Thank you so much, sir.
Doctor, thank you
Just
for answering all our
question.
questions. It
Yeah.
was very helpful, doctor. Thank you.
Thank you. I will be answering some more questions which I've got in my chat. Just a sec.
Okay.
About CRP levels, doctor?
You want to know about CRP? Hello?
Yes, CRP.
Yeah. See, CRP is a C-reactive protein. Okay. See, this is a protein which increases in any kind of inflammatory pathology, like not just COVID. It can increase with a small infection in your legs, small wound on your body, urinary tract infections, pneumonia, cancer. There are various conditions, joint pain, rheumatoid arthritis, any inflammatory conditions can raise CRP. So CRP raise is always a non-specific marker. We use that marker in a particular situation to monitor the seriousness of the illness. It doesn't help us to diagnose the illness. It is only a assessment of the seriousness of the illness or the extent of infection, the severity of the infection. That is what we assess by doing CRP. So like for example, you take a patient who has been operated 3 days back for some disease, some fracture. If the CRP starts raising on day 6, we feel the operated site is getting infected. Okay, so we need to start him on antibiotics. So this is how it is. So it is situationally, we use that. It is not specific to COVID.
Okay.
Okay. Yeah.
Thank you, doctor.
Now, if a patient has got some ear problem and he's on antibiotic and painkillers, so before going for the second jab, should he get this CRP done?
Not required, sir. Just to take a vaccination, you need not get your CRP done. Just to take a vaccination, you need not get your CRP done. When do we do CRP means? That too in COVID, when we do CRP means, you have some kind of a symptom related to COVID, or you feel that you are exposed to someone who is already positive, and you test positive to COVID, RT-PCR is positive, but you have no symptoms. Many people come, sir, I don't have symptoms. Incidentally, test ಮಾಡಿಸಿದ್ವಿ, the test is positive. In such a patient, to decide upon home isolation, should the patient stay at home or should the patient be treated aggressively? To decide, many times we do this CRP, D-dimer, LDH and ferritin levels. These are the inflammatory markers. When a patient who is tested positive without symptoms or with symptoms, when CRP is high, it simply indicates the patient has an ongoing inflammatory process in the body, but patient presently has no symptoms. Like CRP should be less than 10. If CRP is 40, but patient as you do not have any symptoms and you just tested positive, we advise you, sir, you don't have any symptoms, but your COVID is positive, your CRP is high, it should be less than 10, it is 40, it indicates that there is ongoing pneumonia inside your body. So you should be more cautious. So you need treatment, you probably need admission. This is what we advise. So this is the point where the argument starts between the doctor and the patient. Sir, I don't have any symptom, CRP is high, you are admitting unnecessarily. You understand? So when CRP is high, it indicates there is an ongoing process inside. So we need to treat early rather than you coming to us with cough and breathlessness with saturation of 70%. That is the reason we get a CRP done. If CRP is normal, D-dimer is normal, you don't have any symptoms, then you are a candidate for home isolation. Okay.
Good, doctor, about the CRP explanation. Really good.
Yeah. Thank you. Thank you so much, sir. Thank you.
That was very good explanation.
Thank you. I'll just answer other
Sir,
questions. Yeah. Tell me, sir. Tell me.
So suppose the CRP is high post-COVID after 3 weeks, then what does it indicate?
Post-COVID.
Yeah.
Yeah. Sir, if you have significantly high CRP means, do you have any value particularly, sir?
32.
32. Okay. Do you remember your CRP levels when you were infected already?
Yeah, it was a patient of mine.
Okay.
She had about 5.3.
That was during
3 weeks
COVID.
ago.
That was during COVID.
Yeah.
Okay.
Yes, yes.
Now it is 32.
Yeah.
Sir, if it is 3 weeks post-COVID, patient has have a CRP of 32 with no symptoms of COVID per se, then we need to look for other causes.
Yeah.
Sir. We need to look for other causes. That is one. Second thing, rarely there is something called long COVID syndrome, where patients might have an ongoing inflammatory process where the lungs get fibrosed, sir. Fibrotic lungs can happen post-COVID to some patients. In such patients, CRP remains high for a longer time. In such a patient, if you see, they will have some or the other symptoms of COVID even at that point of time. Like they will have cough, breathlessness, or some amount of dyspnea. Something should be there. Without that, the reason should be something else, sir. It cannot be due to COVID.
But she has no symptoms at all. She's perfectly all right.
Then there should be some other reason for raised CRP, sir. Some other infection, some other focus of infection. We need to find it out. If patient is a diabetic, many times post-COVID, they come with urinary tract infections, which can lead to raised CRP, or they might develop some like clotting, DVT, deep vein thrombosis, that can lead to raised CRP. So we need to find out other causes of raised CRP rather than thinking about COVID, sir. That too after 3 weeks with no symptoms of COVID.
Search for another cause.
Yes, sir. We need to find other cause for raised CRP.
Raised CRP. Do we do a chest X-ray at the now again?
Sir, if patient has no symptoms and
Yeah.
just 3 weeks post-COVID, I don't think the chest X-ray will help her in any way. Instead, we can get a CT of the chest done to see if there is ongoing fibrotic changes that are happening inside the lungs.
Okay.
Yeah, fibrotic changes can happen, sir.
Okay. Do we follow up the CRP after some time?
Yes, sir. Usually what I do is in the hospital, when patient is admitted, we do CRP every 3 days, because the CRP levels usually fall or raise in the next 2 to 3 days. Every 3 days we do in the hospital. And after discharge, I usually repeat CRP at 10th day. If it is totally normal, I will just leave the patient. If it is borderline high, even on 10th day, we ask them to come after about 2 weeks or 3 weeks and just repeat the sample and see once. Once it is normal, we will leave them.
Doctor, sorry to come back again.
Yeah.
One question which I don't know if you answered already.
Yeah.
Covishield versus Covaxin. This is a big debate and confusion amongst people. When you call the hospital, they ask you, you want Covaxin or you want Covishield? You are at a loss to understand.
Yeah, sir, actually, this is what is the most difficult question. I'll tell you. See, Covishield and Covaxin. I'll tell you in detail. See, Covishield is manufactured by Serum Institute of India under the guidance of AstraZeneca, which is a Swiss-based company. And this Covaxin is manufactured purely in India by Bharat Biotech. Okay. And this Covishield mechanism, the vaccination technique is little different that has been prepared. They use a small component of the virus, put it inside adenovirus, a different virus called adenovirus that infects the chimpanzees. Adenovirus that infects the chimpanzees has been picked up. They inject a component of coronavirus that infects the humans into that virus, and they create a vaccine out of that. That content is injected into the human body that generates the immune response. So here a viral component is used, not the whole virus is used for the vaccine. But in Covaxin, they use the whole virus. They kill the virus. Only the killed virus is used to create a vaccine. That is Covaxin. Okay. And this Covishield, commonly the side effects, what I said, commonest side effect that we find with Covishield is fever, body ache, headache, tiredness. These are the most common side effects, and injection site pain. Okay. Which can last for 2 to 4 days generally. This Covaxin also has same side effects, plus added side effects include vomiting sensation, that is nausea. They can have abdominal pain, and some people can have vertigo, that is giddiness like feel. This is with Covaxin. That is one. Next thing, means safety wise, as I said, both are okay. Very rarely in some researchers, they said this Covaxin has caused some neurological diseases, but this has not been proved whether it is exactly due to the vaccine or not. So we cannot comment on that. But generally, both vaccines are relatively safe. Second thing, the efficacy of the vaccine, that is both. Both have 70 to 80% efficacy. Only problem with Covaxin and Covishield, why it all started was Covishield, when it came to the market, it had already cleared the phase 3 trial. Okay, phase 3 trial means the vaccine was already tried in more than a lakh of people before it came into the market, Indian market. Okay, but this Covaxin was still in phase 2. It was just entering phase 3. That means simply saying this phase 3 trial of Covaxin was done in India directly on the public. Okay, so phase 3 Covishield was over. Covaxin phase 3 was in the vogue. So it was one step below Covishield only during the trial phase. That's all. Otherwise, there was no issue at all. And the immune response, both 70 to 80%. So I don't think we need to worry about these vaccines.
Thank you, doctor.
Hello, Dr. Vinay.
Yeah, tell me, madam.
Yeah, as you said, we avoid albigatran or acetron for patients, cardiac patients before vaccinating with the risk of IM site bleeding.
Correct.
So I just wanted to know how many days prior to vaccination should we stop the drug, and post-vaccination, when should we ask the patient to resume the drugs?
Yeah, usually that all depends on the half-life of each drug. That means the excretion rate of a drug that has been taken into the body. That is what we medically call it as half-life. Means the reduction of the drug percentage in the body by 50%. Okay, so on an average, considering all the anticoagulants like acetron, warfarin, dabigatran, rivaroxaban, everything, I can tell you on an average 5 to 7 days. So you can just tell the patient 6 days. That is more apt. But
6 days before and 6 days after.
Before 6 days prior to the vaccine.
Okay.
But if patient is on acetron or warfarin, you can get their prothrombin time done. PT, we call it as prothrombin time. If prothrombin time is less than 1.5, means INR we do. If you know, there's something called prothrombin time and INR, international normalized ratio. If INR is less than 1.5 for a patient who is on acetron or warfarin, patient can still be vaccinated when the patient is taking the tablet. But other medicines like dabigatran, rivaroxaban, all other anticoagulants have no proper test to know whether it is still be okay to take. So for safety, we say stop it for 6 days, take the vaccine on the 7th day, resume taking the tablet on the next day itself.
Thank you for being so clear. Thank you.
Yeah, thank you.
Doctor, just want to understand, is the CT score very critical one to use for treatment, even if your CRP and dimer are low?
Yeah, correct. This is actually a nice question, but yeah, CT scoring, no, many times anything above 15, anything above 15. See,
Okay, talk about a scale of 25 or 40, because I've seen different scales by different diagnostic labs.
Correct. I understand. Many times, see, out of 40, if it is above 15, out of 40, if it is above 15, it is good to admit, treat instead of looking at CRP and D dimer levels. Out of 25, when we do 25, anything above 10 needs to be treated.
Okay, because the doctors suggested, for even for 20, they said out of 40, they said other vitals, blood reports, all are normal. So they said hospitalization is not required.
Okay.
So that's the reason wanted to understand why they were insisting no hospitalization.
Yeah. If there is one thing I'll tell you, if you have gone to the hospital after about 10 days, 11 days, or 12 days after your symptoms, okay, if at all 10 to 12 days after your symptoms, then many times if you have been infected and you're already recovering, your CRP, which was high initially, probably, which was not tested, might have come down to normal, and your lungs are already recovering. Even during the recovery phase, if you get a CT scan done, the scoring remains constant. Means the scoring will not come down after a course of treatment immediately, because the radiological resolution of pneumonia takes a longer time. So the scoring remains 20, but patient would have recovered. That is one possibility where that advice might have been given to you.
So it was less than
Otherwise,
10 days. It was 8 days.
yes, sir.
Doctor, it was around 8 days.
Okay. Did the patient have any symptoms, sir?
No, no symptoms.
No symptoms at all.
But yeah, but CT score was increasing from 17 to 20. CRP increased after 8 days from 5.5 to 10.
Okay.
And dimer was under control.
Okay. That is what actually raising CRP, raising score, we generally advise admission and treatment, sir.
Okay.
That is what is generally recommended. It's probably individual, I don't know, individual immunity. Patient might be safe. Generally, raising trend, we generally treat, sir.
Thank you, doctor.
Yes.
Hello, Dr. Vinay. Hello.
Hedi.
Hello.
Yeah, tell me.
Hello, Dr. Vinay.
Hedi,
So
Hedi.
my question is, government announced the vaccination can be taken above 45 to 60,
Correct.
means above 45 age.
Okay.
But my question is, what about below 45, who has to work with the mass means labor class, means labor class and workers or filmmakers like that.
Yeah.
What they have to do? They means what? How they have to be work with the mass?
Yeah, yeah. I'll tell you.
That is my question.
Yeah, yeah. I'll tell you. See, what the government actually planned was, first they targeted a high risk population in increased number. That means like a particular class or particular community of people who are in large number, who are at high risk of exposure to COVID. That is, there are 2 points you need to concentrate. That is, large number of people, high risk of exposure. That is, doctors community, police, what should I say? Scavengers means Paura Karmika means scavengers class. All these people are hospital, any hospital staff, including the reception hospital staff. So those are the people who are in increased number, who are at high risk of exposure, who were targeted first. Next, the government came down to a high risk population in number, that is age above 60, who are at high risk of deaths. That is because during the infection period, many people who died were above the age of 60. So they targeted that population first. Next, they are bringing down the age. Then they said above the age of 45 up to 60 with risk factors like diabetes, heart disease, open heart surgery, any other things. Means public with high risk in increased number, both should match. They should be at high risk, they should be in increased number. Both they target first. Next thing they do is anybody less than age below 45 can be vaccinated, and that will come. So it is like, because the vaccine manufacturing takes its own process, you cannot ensure to provide vaccine to the whole public at one point of time. To ensure that, they first start targeting the high risk population who are in increased number. Once that is over, then they give it to the whole public. So it will take its own process. I think that should be done in the next 2 to 3 months.
Okay. So this may be the reason it is what is that? It is becoming more now. Is this becoming more now because of this reason?
What is becoming more?
What age people are affecting more now? Can you answer? Means not like that.
Every age group is getting infected. There is no particular age. But only thing is, people who are getting serious infections are definitely aged people. See, in our ICU presently, we have 10 patients in ICU, and only one patient is 48 years. All other patients are aged above 60.
Okay.
So it is like that. The high risk population is actually, they say it's age above 50, but we are finding people age above 60 who are seriously ill, and we have one patient age 48 who is seriously ill.
Okay.
Doctor,
Doctor, now,
Dr. Vinay?
when is the when is the age limit likely to come down for our staff who are about 25, 32, 34?
Sir, I think that has to be answered by the government only. We really do not know. That I cannot answer. Because
Doctor, but I've seen many people getting, the vaccination who are below 40. So, I mean, I've come up many people.
Yeah.
So is that, I mean, I've been hearing, they hospitals fill it as comorbidities and, put the vaccination. So does that result in any kind of negative information for us in the future?
No, sir. Actually, the thing is, it is like black money. Means, what should I say? If they're getting vaccinated, what I should say is, usually above the age of 45 with comorbidities can be vaccinated. That is what was told. But from April 1st onwards, anybody above the age of 45 can get vaccinated. Above the age of 45 with or without comorbidities can get vaccinated from April 1st. That's all. But below the age of 45, if you are telling me, I don't know how is it happening. If at all, I'll tell you one thing that can happen is, when we get a vaccine vial, no, it contains 11 doses in a vial. Okay. The government says 10 doses has to be given. 1 dose is considered as a wastage. Sometimes when you take the vaccine, no, you get little more, little less. So we need to adjust the dosage. So that 1 dose, that extra that is provided in the vial, is taken as a wastage. Some hospitals illegally are giving that extra dose to the public, but such patients generally do not get the certificate. You cannot log in saying your age is 40. Such patients many times will not get the certificate.
Doctor,
Okay.
can I just help you that there's a little more to that answer. Basically, people were saying that they were frontline workers and getting it.
Yeah,
Now that's why the government has stopped that. They have put a stop to frontline workers and doctors. I mean, that category they have closed below 45.
Correct. Exactly. That has been done earlier. That is probably they are closing it. Right, sir. Thank you so much.
Doctor, what is the difference between CRP and ESR?
Okay. Yeah, I'll tell you.
Doctor, doctor, just to add to that, even interleukin 6, I've been seeing, people being asked to do the test for infection. So interleukin 6, ESR and CRP.
Yeah, I'll speak about all three: CRP, ESR, and interleukin 6. Okay. We'll keep ESR aside first. We'll speak about CRP and interleukin 6. See, this CRP is, as I said, it is a C-reactive protein. It is a protein that is released by the liver. Any inflammatory process going in the body, any inflammatory process like joint pain, infection, cancer, anywhere, this CRP levels can raise. This is a protein. It is a protein. It's a reaction to an inflammatory process by the body. It starts raising. That is, CRP starts raising. Whenever this protein raises, we need to look for the primary cause of the raising CRP. You cannot diagnose a disease by seeing a CRP. Like, as I said, patient is operated 5 days back. On 6th day, patient develops low-grade fever. Then you send CRP. CRP is high. It means patient has got some infection. So post-operatively, if patient gets infected, it means CRP is high. It means patient has got infected. We need to look for the infection at the operation site. So it is all situational usage of CRP. Okay, and ESR, as I said, it is nothing but erythrocyte sedimentation rate. It means during a lab test, this level of ESR means it is different for males, it is different for females. Males ESR is generally low, females ESR is generally slightly high compared to the males. Okay, this ESR starts raising again in many cases like infections, cancerous conditions, arthritis, many other conditions where there is ongoing inflammation, or sometimes Antala, Not only just inflammation, ESR can also raise in patients with low hemoglobin, means anemia. Whenever patients have anemia, they can have a raised ESR. So even ESR is always situational. It cannot be used to make a particular diagnosis. It is only a supportive evidence to make a diagnosis. So you cannot say ESR high, you have certain disease. You should correlate. Patient has hemoglobin 7, ESR should be high. So it is like this. So you need to find a primary cause for ESR. Okay, ESR is done in a lab. It simply means it is the speed at which the red blood cells settle down in a tube. There is something called Wintrob's tube with which we do ESR. When the RBC settle down, the speed at which it settles down is what is called ESR. That is always situational usage. And as you, one more thing I said, it is interleukin 6. Yeah, this interleukin 6 is mainly released by the white blood cells. That is white blood cells, monocytes. Okay, these white blood cells release the interleukin 6. See, interleukin 6 is raised in, again, it is raised in any inflammatory process, infections. Why do we do interleukin 6 in patients of COVID is, whenever patients pneumonia is increasing or patient is deteriorating, we do interleukin 6. That is to see there's something called cytokine storm. If you have heard this term, cytokine storm, it means these white blood cells, that is, which is used for immune response in the body, they become chaotic. It simply means you want the immunity to act to protect the body, correct? But when the same immunity acts chaotically, or they wage a war on you, or they create a war on you, it simply means only 10 WBCs have to come to prevent the infection or to decrease the infection. What if 100 WBCs come? What happens? They release chemicals like this interleukin 6. What happens when the immune response is too much is the whole lung gets destroyed because of the immune response. It is not actually COVID infection that destroys the lung when interleukin 6 is too high. It is this interleukin 6, which is a cytokine, which creates a chaotic release of many chemicals, causing release of fluids into the lung. When the lung is occupied with this body fluids instead of air, patient cannot breathe. So it simply means the lung with air is filled with fluid. What fluid? Inflammatory fluid. Why inflammatory fluid? Because of high levels of interleukin 6. Why high interleukin 6? Because of chaotic activity or war against self that has caused by the WBCs, which causes this interleukin storm that leads to destruction of the lungs. So COVID infection, small pneumonia, interleukin 6 release, that is cytokine storm, larger lung damage. So that is the stage which is very, very difficult to treat. That is the reason in COVID pneumonia, to avoid interleukin 6 surge or cytokine storm, we use steroids. If you know, in patients with COVID pneumonia, we use injectable steroids to prevent this cytokine storm or interleukin 6 surge. That prevents more serious illness to the patient. Anything else, sir?
Thank you, doctor. Thank you very much.
Yeah, thank you. Thank you, sir.
Sir, last one question.
Yeah, tell me, sir.
Hello. Sir, is it enough to wear N95 mask for examination of patients, sir?
Yes, sir. What N95, sir?
Sir. Or you want another surgical mask to other one?
Yeah.
Or one?
Yes, sir. About the mask, if I have to tell you, sir. See, one simple thing is, whenever you are at high risk of exposure to the virus, you need to use a N95 mask. You are at less risk of exposure to the virus, you can use a regular 3-layered mask. Okay, because you are a doctor and you are at risk of exposure to them, preferably using a N95 mask helps. And first thing what I wanted to say is this N95, as we all know, it has a 95% filtration capacity. Correct. But what does it filter actually? What does it filter? When you read about it, they say it mainly filters 95% of the smallest dust particles or aerosol splashing. Aerosol splashing. Okay, everywhere the description is like this. But when you have a proper N95 mask, the risk of viral transmission is less, but it is never zero. Okay. So
One question, sir.
yeah, and one more thing is among the N95 mask, you have various varieties. Okay, you have about 5 to 6 varieties of N95 mask. If you have seen, some people wear a white mask with a yellow band, some have a green mask with a white band. All are N95. But if you go through a standard N95 mask which has been produced for the first time by 3M company, 3M, you have a code, color code. Green colored N95 is coded as 1860, and white colored N95 mask with a yellow band has a code of something like 8210. Okay, depending on the code, their filtration capacity is different, sir. Both are N95 only, but white with yellow band is different, green with white band is different. They say when you do surgery, you should use green N95 mask with a white band. For a regular usage in the hospital practice, like in OPD, you can use a white mask with a yellow band. This is what is recommended, sir.
Sir, one question. Sir,
one quick
sir,
question.
sir, yesterday I have seen one patient.
Sir, tell me.
Hello. Sir, yesterday I have seen one patient. With fever, I have given paracetamol IV. After when I sent that patient, it is got positive. So shall I take any care or shall I any isolation?
Sir, actually, see, you have given paracetamol, correct, in the hospital. You were wearing a mask?
Yes, sir. One N95 mask and about that one surgical mask and face shield. Sir.
Okay. Did you wash your hands after touching the patient?
Yeah, I wear gloves also, sir.
Okay. After that, you anyway washed your hands, right? You didn't, correct?
Sir, I have changed the gloves afterwards. After half an hour, I have changed the gloves also. Sir.
Then I don't think you should worry at all, sir. Nothing to worry. You need not get isolated, sir.
Because to avoid family members and for children, so correct. Since yesterday I have not visited home also, sir.
No, sir. See, you have seen the patient wearing a mask,
sir,
wearing a glove.
IV paracetamol.
Yeah, no issues at all, sir. No issues at all. You just have to discard the mask if you have exposed to him. Discard the mask.
I have. Sir, okay.
That's all.
But not necessary isolation anything.
Not necessary, sir.
So, doctor, is surface transfer still a myth or is it reality?
People who have had, let's say, a clot, right, blood clot, is it safe to take Covishield vaccine?
Sir, I could not hear you. Tell me, sir.
I was saying that people who have had a blood clot in the past, let's say past 3 months, is it safe for them to take Covishield vaccine?
No issues at all, sir. They can take a vaccine. Vaccine has no relation to blood clotting, sir.
Yeah, so now we were reading some news that, the Oxford AstraZeneca, vaccine has some cases of blood clotting reported in UK and some European countries.
Yeah.
So that is what I was asking. I'm also on blood thinners right now. So that's why I was asking, like, is it okay to say take Covishield?
Correct, sir. See, in India, we have not found anybody who have got blood clots due to Covishield per se, sir. Probably it is genetic oriented also. So I don't think we need to bother about it right now. We have no data in India saying that Covishield has caused a lot of blood clots, sir. Actually, post-COVID, patients who have high D dimer levels post-COVID, they are prone to blood clots, sir. Post-COVID pneumonia, post-COVID infection, they are prone to blood clots. So we give those patients blood thinners for about 4 to 6 weeks post-discharge, sir.
Okay. Thank you, doctor.
Yes,
sir.
sir.
Surface transfer still, hello, doctor, is a surface transfer still something we need to be careful of? If there's a COVID patient in a room, right? Yeah. After how many days can we enter into that room without any sanitization?
Sir, actually there is a, I don't exactly remember, but they say any glazed surface, okay, anything that is shiny like glass or any glazed surface, the virus can stay on the glazed surface for about 3 to 4 days. On a metal surface for about 2 to 3 days. Okay, so usually on an average, about 4 to 5 days, the virus should be killed.
Okay. Yeah.
Good afternoon, sir.
Yeah, tell me,
Sir,
madam.
are you able to hear me?
Yeah, I'm able to hear you, madam. Tell me, madam.
Sir, this in between Covaxin and Covishield, which one to prefer? Because before in Bangalore only Covishield was there, now Covaxin has come. So any patient, according to patient condition, any preferences are there?
No, madam. Anything can be used. Both have similar efficacy. So nothing much to worry about. There is nothing to select out of it, madam.
Sir, today I saw a case. Lady has taken Covaxin 3 weeks back. After vaccination, she didn't develop any fever, anything. 3 days back, she came to me with fever, body pain, and all. She was looking quite sick, so I advised COVID test.
Yeah.
But attender was little reluctant. Somehow they did. She came positive.
Okay.
So I mean, how far? Like after first dose, like can't be sure that we will get immunity.
Sir, that is why actually I answered all these questions earlier, but I'll just repeat it. See, after taking any vaccine, madam, any Covaxin or Covishield, after completing the second dose of the vaccine, you need to wait for at least 3 weeks for the immune response to come. So it is about 3 weeks after the second dose. So if patient has taken the first dose, after 15 days, patient turns out to be positive. That is expected, madam. Patient has to wear a mask to prevent the infection. Even after the immunity is good also, still they are prone to infection. Only thing is the seriousness of the infection will come down, madam.
Okay. Okay. Thank you, sir. Thanks.
Yeah. Thank you so much.
Sir, what is the thing what you mentioned, high risk and low risk among the people?
Sir, high risk means like doctors. Say we are doctors, we are always exposed to such patients. So we come under high risk category, number 1. Number 2, police. Police are into the public service. They need to be protected to save the country. So they come under high risk category because they are more attached to the public. Next thing is the scavengers, cleaners who are doing their job even during lockdown. They are high risk people. So they need to be vaccinated. After that, high risk related to health, like age above 60 years, people are dying more. So they come under high risk because their baseline immunity itself is low. Next is patients with immune suppression, like diabetes, kidney disease, dialysis patients, heart disease. All such patients have low immunity. So they come under high risk category. So like that, we categorize a high risk population, sir.
Doctor, my husband has got varicose veins from too many years, and it is quite big. It's just behind the kneecap. So there, the varicose veins are there. So can he be vaccinated? Is my question.
No,
because that's nothing but clots, isn't it?
No, it is not a clot. Varicose vein is not a clot, madam. Varicose veins is the veins which were straight have just become like a snake. That's all. That means the straight veins have turned out to be a snake-like veins. There is no clot inside, madam. So he can definitely take it. No issues at all.
You mean the blood is flowing properly then?
It will be flowing slowly, madam. It will be flowing slowly. That's all.
Okay.
Yeah.
Doctor, I am Rotarian H.G. Parekh.
Yeah, tell me, sir.
I was on 15th September, I was totally fainted and I was admitted in a hospital. They gave me an emergency injection. After that, my entire body clot was released and I was there for 5 days. Now I am all right, but still I am getting some giddiness. जैसा कि चक्कर आ रहा है ऐसा मालूम पड़ता है, but I don't fall. But I feel that I am getting chakkar. I've already had 1 dose of Covishield on 5th December. Second dose I'll be having by 15th April. Can you suggest me anything?
For what? Giddiness, sir.
Giddiness. Something there's a chakkar aa raha hai karke. I don't fall, but I feel that I am getting chakkar. I may fall,
sir,
but I am not getting.
Sir, I think because your medical history is there, I think you need to consult the doctor directly to check your blood pressure. And once we need to examine you to come to a conclusion, sir. It's very difficult to say the cause of giddiness, sir, over phone.
Daily I am taking Ecosprin at the night. One tablet of Ecosprin daily I am taking.
You can continue taking, sir. You can definitely continue taking, but please consult the doctor to check your BP once, and only then we can come to a conclusion, sir.
Thank you.
Yeah, thank you so much.
Hello, sir.
Hello.
Hello, sir.
Tell me, madam.
Hello, sir.
Yeah, tell me, sir. Tell me.
Nothing, sir. Actually, I just wanted to ask you that is there a relation after taking this one vaccine? After how many days we can give diclo injection, sir?
Sir, actually, vaccine has no relation to diclo, sir.
And actually, that one, this one, in viral news was this one spreading around the WhatsApp, sir.
Sir,
That one of the doctor.
Yeah, sir. That is actually patients with COVID infection or COVID pneumonia.
Okay, sir.
We avoid giving painkillers, but patient who has taken a vaccine,
okay,
there is no relationship, sir.
Okay, sir. Okay, thank you, sir.
Yeah, thank you so much, sir.
Hello, sir.
Yeah.
Hello, doctor.
Yeah, tell me, madam.
Hello, sir. Before we were taking more measurements to wearing gown and all. Now we are not practicing in our GP practitioner. How precaution should we take in at clinics?
Madam, only thing is, even at the clinic, no, when you are examining the patient, please wear a N95 mask.
Yeah, okay.
Try to maintain social distance. Use sanitizer frequently. And what I do generally is, whenever I examine the patient, or you need to auscultate, or you need to examine the chest, many times people are not touching the patient at all because there is COVID. You keep a shield in front, you don't touch the patient. But if you without touching the patient, it is difficult to come to a conclusion, make a diagnosis. So what we can do is, if you really want to touch the patient or examine the patient, please do not come in front of the patient. At least wear a mask, wear a glove, use sanitizer frequently. If you want to examine the chest, means use your stethoscope. Please stand behind the patient, or keep the patient sideways. And you can examine the back with your right hand, examine the front with your left hand. Use a stethoscope, front and back, so that when patient takes deep breath, they will not exhale onto your face. They will exhale outside. I think that can be done. That is what I do in my OPD. I don't directly see the patient and examine. I ask them to turn backwards or turn sideways and examine, and do sanitize your stethoscope with at least a cotton swab or with sterilium.
Okay,
I think that should be okay.
Hello, doctor.
Hello, doctor. Hello.
Doctor.
Yeah, tell me, madam. Tell me.
Actually, the thing is like for those people who have drug allergies with fluoroquinolones and penicillins, can they be advised to take the vaccine?
Definitely, madam. Fluoroquinolones and penicillins has there is no content that is inside these antibiotics that is in the vaccine. Means there is no mix. What should I say? The content in the medicine, the content in the vaccine doesn't match, madam. So I don't think you should worry about it.
Because we have got the one PDF where like they have given contraindications, and it was clearly mentioned there. Those who have the like any allergies to any drugs or any food allergies, they are not allowed to take the vaccine.
Not at all, madam. Not at all. That's what I said. Some had a doubt that I have egg allergy. Can I take the vaccine? Because most vaccines have egg protein. But there is no egg content is not used inside the vaccine, madam. So you can definitely take.
Okay. Thank you so much, sir.
Hello, doctor. My husband is 52.
Yeah, tell me, madam.
He took the vaccination on Saturday. Today is already Wednesday. Still, he feels little tiredness, and he is taking Dolo 650 every day, morning and night.
Okay. No,
And
is he
he's
having
still
fever, madam? Fever?
No, doctor. No fever. Nothing else. No cough. Nothing else. But he tells he feels little tired.
Okay. One thing I can suggest you is he took a vaccine on Saturday, right?
Saturday. Yeah.
Okay. Today is
Wednesday.
Yeah, day 4, day 5, right? Okay. What you can do is I think you need to wait for 1 or 2 days. If it does not resolve, please get one COVID test done, madam.
Okay.
Because when you go to a vaccine site many times, when you sit in that crowded place or when you are in that waiting area, many people would have taken out their mask, and even you don't know, the mask might be below your nose. So in the vaccination site, because of crowding,
But the vaccination site was full. He was the only person when we went.
Okay.
So nobody else were there.
Yeah, good. Unlikely, but the thing is,
Okay,
whenever the fever does not subside within 2 to 4 days, and
Okay.
patient has some symptoms, we expect that he could have been infected. So you can just get it tested to confirm that there is no infection.
Okay, doctor. So we can wait for another 1 or 2 days.
Yeah, definitely.
But is that fine? Dolo 650 can he take today night also? Fifth day?
If he has fever, he can definitely take fever.
No
body
fever,
ache.
doctor. You told him no to give fever, mobile only number, tired.
Madam.
Then I don't think you should do anything. You just wait for 1 or 2 days, madam.
Okay. Okay, doctor. Thank you.
Doctor, when can a painkiller be taken after a jab of first dose or second dose, preferably for any other kind of pains?
Madam, no relation to painkillers with respect to vaccine. Yeah, it's only about COVID pneumonia, COVID infection. We don't give painkillers, but there is no relation to vaccine, madam. But preferably we give paracetamol because that should suffice. I don't think you need such a intense.
No, later after the vaccine dose, sir, later when we develop a headache after a week or something, just for some other reason.
You can take it, madam. No issues at all.
Okay. Thank you.
Yeah.
Hello.
Thank you. Thank you. We are closing the session for today.
Can I have one question, please?
Yeah,
Hello,
last
doctor.
question. Last question, please.
Last question, I'll take it. Doctor, could you suggest first shot and the second shot should be a same make, or it may be Covishield and Covid?
Same make only, sir. Same make only.
Okay. Thank you, sir.
Hello, doctor. Can I ask one question?
Yeah, last question, madam.
please.
Last question. Yeah.
Yeah,
finish.
actually, I wanted to know about that asthma patient, whether they can take that co-vaccine. Is it okay for them?
Definitely, madam. Definitely.
Okay. And for asthma patients, is there any more precautions because they are not able to that mask 24 hours? No, that is very difficult for them.
No,
Mask
madam.
is there.
Asthma patient can also wear a mask. They should wear a mask. If asthma patient is not able to wear a mask, asthma is not under control. Probably that needs treatment, madam.
Okay.
Shall we get your number, sir? If any patient should we refer?
Surely. I'll give it to you. Sir, your name?
Sir, Dr. Santosh Kumar, Vijayanagar.
Surely, sir. Sir, can you tell me your number, sir?
9986
9986
4466
66
08.
Sir, your name, sir?
Dr. Santosh Kumar, sir.
Surely, sir. Surely. I'll call you back, sir.
Okay, sir. Thank you, sir.
Yeah. Thank you so much, sir. Thank you. Yeah. Thank you so much for all the
Sir, can you please tell anything about the second wave, sir? Now that is the thing which is going on. So we didn't speak about it. So that is the last question. Sorry to interrupt, sir.
Yeah, wave has to be stopped by the public, madam. They should start wearing a mask. Avoid.
No, is there any different way of presentation of the COVID itself, or is it really difficult to diagnose? Like the WhatsApp is telling all sorts of things. That's why I'm asking you this question, sir.
Madam, simply I'll tell you. One is fever, headache, nasal blockade, loss of smell, loss of taste, generalized body ache, severe unexplained tiredness. Okay, fever, tiredness followed by loose stools. Loose stools. These are the common complaints which we are seeing in COVID nowadays. In this wave. That's all.
Okay. The second wave is also presenting the similarly then. It is not anything different.
Nothing different. But loose stools patients are more now. That's all.
Okay, sir. Thank you so much.
Thank you so much. Thank you all for the cooperation.
I'd like to thank you from all our from everybody's side. You explained very well and it was very helpful session. Thank you.
Yeah, thank you. Thank you so much. Thank you so much.
Thanks a lot, sir.
Yeah, thank you.
Thank you, doctor. It was an helpful session.
Thank you so much. Yeah.
Last minute.